Welcome to I Wish You Could Hear This, where we explore great stories and simple proven steps to help you thrive in life, faith, and relationships.
In our research, we've heard hundreds of hope-filled strategies for marriage, parenting, leadership, and life that are grounded in science and consistent with biblical truth. And now you can hear them too.
I'm Shaunti Feldhahn.
And I'm Jeff Feldhahn.
Before we introduce our guest for today, we want to let you know this is not a typical show as far as it relates to the aha moments that we usually uncover, but we hope you'll find it just as interesting. And if you are self-employed or concerned about how you're going to afford your rising healthcare costs, which, we all are, we are hoping you'll actually find this episode helpful because today we're diving into what we, as self-employed folks, have done for healthcare coverage and how God provided for the huge healthcare costs that have come with my ongoing breast cancer treatment. For 8 years, or probably more than that now, we've been members of a healthcare sharing ministry called MediShare, and we've had many people ask us, what is MediShare like? So now that we're in open enrollment season and lots of families are experiencing sticker shock about their insurance premiums, I wanted to have a candid conversation with MediShare's Chief Medical Officer, Dr. Ian Day. We're going to ask him all the questions you would probably want to ask and share our story. So if you are curious about MediShare as an alternative to traditional healthcare, or you're just interested in biblical wellness and stewardship, that's what we're going to be covering on this episode of I Wish You Could Hear This.
Dr. Day, thank you for joining us on the podcast.
Shaunti and Jeff, thank you for having me on your show.
Thanks. Well, you said that it was going to be somewhat educational.
It will be, I think.
I think it's also going to be encouraging because we've had a conversation with Dr. Day off camera. And honestly, what MediShare has done for us, and what I think people, feeling the stress of how they're going to provide for their health, coverage. I think this should be and will be encouraging for the listeners. So for the listeners who this is kind of all new, let me give you a quick introduction of who Dr. Day is. He's been a practicing physician for over 25 years and serves as the Chief Medical Officer at MediShare. He has broad experience in the healthcare industry and a passion for biblical wellness.
Yeah, and Dr. Day, we want you in just a minute to share with our listeners a bit more about how MediShare works sort of directly. But before we get into that, we want to tell our story of what prompted us to consider MediShare to begin with. Back in, I think it was 2017 or so, due to the impact of the Affordable Care Act, the ACA.
And you and I have had a little bit of a disagreement on this date of time.
I need to just look it up on the portal. I think it was 2017.
I think it was 2013. But
Okay.
Nevertheless,
we've been MediShare members for a while. But in whatever year that was, I think it was 2017, because of the ACA, suddenly there were different localities around the country that became insurance dead zones. A lot of people may not be aware of this, but there are these places where all of the regular insurance companies pulled out. So, and our area was one of them. So, our insurance company was Aetna at the time, and they sent us a letter saying, hey, we're no longer going to provide insurance to your area. So sorry. And so we went online to the central portal to figure out, okay, what are our other options as self-employed people buying independent insurance plans. And we were completely shocked to find there were no normal insurance plans being offered, literally none. So we were forced to look at other options, and that's when we first found MediShare. And we loved the lower monthly premium, even though MediShare doesn't call it that. But we were a little skeptical at first, to be honest, because our son had epilepsy and our daughter had asthma. We knew that we would be paying a bit out of pocket because those were considered pre-existing conditions for 3 years. And we were worried, like, what if something down the road really big happens? How is this going to work? And then 4 days before Christmas in 2020, that really big thing did happen. And I've spent the last almost 5 years undergoing breast cancer treatment, and MediShare was magnificent. Sorry, I get emotional about it. We found it really does work. It's a completely different model of how to cover healthcare. It takes some getting used to, but it has definitely been a blessing to us. And so I will put this in the show notes, but I'm going to give you a link before I forget. You can check MediShare out directly at medishare.com/serve, or text the word serve to 70246. Okay, I'm going to get my emotions under control here. On to the questions for Dr. Day.
Yeah, and I, those emotions are real. I mean,
yeah, I'm not making
there are these moments in our lives where life can take a turn, and
that was one of them.
And
you have breast cancer was one of them.
Exactly, and it could have been compounded and gone through very differently than we did.
Yeah.
So, Dr. Day, for the listeners, I mean, could you share with them what MediShare is and how it differs from traditional health insurance?
Yes, thank you for that opportunity, and thank you, Shaunti, for opening up and telling us about your story. I just want to say that we care for you. We care for you, Shaunti. We care for you, Jeff. And that's something that distinguishes us from insurance as well. So I just want to say that as an aside.
Thank you.
Yeah.
You mentioned MediShare, and sometimes people have heard of Christian Care Ministry. So it might be worthwhile kind of to back up a bit and define what those are.
Mm-hmm.
So
yeah, that'd be great.
Christian Care Ministry, or CCM, is a not-for-profit 501c3 organization that administers the MediShare program. Well, what's the MediShare program? It is an accredited healthcare sharing ministry. It's a membership, a community of believers that enables members to share in other members' medical bills according to guidelines voted on by the members themselves. So members share in other members' medical bills through their own individual member accounts. What's the purpose behind MediShare? I think this will bring some contrast with insurance as well. Well, our purpose in MediShare is to bring Christians together over the past 32 years, to share in God's blessings and to share in each other's burdens. Members share in each other's eligible medical bills, and that means bills from doctors, hospitals, operations, testing, treatments, etc. But also we share in the spiritual burdens that often arise in the healthcare journey. So staff come alongside members in prayer with every call. We have multiple departments in this organization, and one of the departments had over 400,000 prayers last year. And that's just one department. So I love that. And how impactful is that? That hundreds of thousands of calls go up in prayer. And staff come alongside members with coaching and education. And it's important to, I think, take away this idea that the MediShare program is built on a foundation of like ideals agreed upon by the members. So there's peace of mind knowing the people sharing your contributions are not using your money for things that conflict with your faith. In other words, there's peace of mind participating in God-honoring healthcare. And this aligns with Acts chapter 2 and Acts chapter 4, which are some of the building principles that MediShare was founded on back in 1993. In MediShare, all the adult members must acknowledge Jesus Christ as their Lord and Savior and profess to the posted statement of faith in order even to qualify for membership. You don't see that in insurance. And members agree to live by a biblical lifestyle, biblical standards, bearing one another's burdens in prayer and regularly attending church. So hopefully in kind of going through that, one can see the difference between MediShare, healthcare sharing, and insurance.
Well, and it makes sense of why MediShare is so much cheaper than traditional insurance, because you've got, hopefully, the group of people that are each contributing in are hopefully living maybe a more healthy lifestyle, trusting the Lord for behavioral choices, even when it's difficult, because being a part of church and community, hopefully you've got a group of people that's better risk from
You're,
healthcare
you're
standpoint.
right. When you have insurance, you pay for other people's lifestyle choices, which could be non-biblical lifestyle choices. Well, our membership has decided that it won't share in illegal drug usage. Say somebody's in the hospital because of a car wreck because of cocaine or something like that, or drunk driving. Well, these things are not shared in. The membership has decided to support biblical lifestyle, not non-biblical lifestyle choices. So MediShare does not share in abortion or gender reassignment treatments or mutilating operations such as that. So you're right. When you exclude non-biblical lifestyle choices, you can then have a, a more affordable healthcare option.
There is a very unique and actually quite emotional thing that happens when you've been used to dealing with normal insurance, and then you're on the phone with MediShare, which it's a big organization that has policies and phone lines and waiting
And
and
things that they
like
need to
and
accomplish.
things they need to accomplish, just like any other organization that's serving hundreds of thousands of people. But there is something really like whoa that happens when you've been okay. I have this thing that I don't think this charge was right. Can I get MediShare's help to do whatever? And you're going through all the technical stuff, and then you end with the person saying, how can I pray for you today? And
That's
it's
wonderful. Yeah.
just like
Well, in my case, the first time that happened, it was, I love prayer, but it was pretty jarring. It
Yes.
was, it was, excuse me?
what huh what okay, I have to tell the story of what happened a couple weeks ago, because I was at I part of the issue with the breast cancer is that I have to take these daily cancer therapy drugs that make you at higher risk for other things. And so in my case, that's kidney stones, which is lovely, right? That I'm at higher risk for kidney stones. So a few weeks ago, I was at an ultrasound center to get an ultrasound to figure out what's going on. And there was a mix up, as often happens with the business office of this place. And, they hadn't called MediShare or whatever. And you need to get pre notified in order to, do these things. And so the billing lady at this ultrasound place pulls me into her office, and we spend, I don't know, 20 minutes on the phone with her going through all the different menus and talking to, okay, here's what we need as far as the pre notification, whatever. And she was very polite, and the MediShare people were great. We get to the end of the call, and the lady on the other end of the line at MediShare says to the insurance, to the billing lady, how can I pray for you today? And you could see the billing lady was like, what? Like, I'm good, thanks, and hung up. And she said, I feel like I'm constantly on the phone with these folks, and spending 10, 20 minutes talking to whatever about whatever, and just they're all the same. And I said, and she's like, I just did the same thing with Aetna 10 minutes ago. And I said, except Aetna didn't offer to pray with you at the end of the call. And she just about spit out her coffee. Like, she started laughing. She was like, okay, good point. And then we had our little meeting that we needed to have about it. And as I walked out, I could tell that she just was having like a hard day. Like, you could just tell, how sometimes you can just tell with people.
Hmm.
And I said, you have been so kind during this whole thing and trying to take care of all of these things. Can I pray for you? You seem a little like today's a hard day. She said, it is a hard day. And she said, okay. And I guarantee you that that door would not have been opened. And I just prayed for her for just like a minute, but I guarantee you that door would not have been opened if it hadn't been for MediShare,
Beautiful
the
story.
MediShare lady
Oh, that's great.
doing the same thing and setting it up. So
And of
it
course,
is very different.
and of course, that's not just MediShare. It's as Christians we plant these seeds.
Right.
And then on his providential timetable, those seeds grow. And we don't know
Yeah.
that timetable, but our job is to, as Christians, is to share His word with others and pray for
Hmm.
them.
Yeah.
Yeah.
One of the things that, whether or not we've been MediShare members for 12 years or 8 years, Shaunti and I will work that through
We will
in
figure
our
that out.
marriage. But what I can say to the listeners out there is that at the beginning, when we started this, it was not unusual when I would encounter a medical professional and I'd say, we use MediShare, and they would go, "Excuse me?"
Huh?
But now, I mean, they've been exposed,
Yeah.
and
It's
it is
well
not
known.
it doesn't get the cocked eyebrow or the how do we handle this. And so I really appreciate that you all have been doing this. You said for 30 plus years, Dr. Day. So
Yes, that's right.
you've kind of, yeah, you've laid the foundation, and we're all benefiting because now it's a known commodity.
Yeah, and it was in 1993 that MediShare was created. And you mentioned the prayer is so important, but the next common question is, well, does it work?
Mm.
And so MediShare has a proven track record in that regard for over 30 years. The MediShare community has shared in every eligible medical bill as determined by the member voted guidelines. And
Wow.
we now share in more than $50 million each month for shared medical bills. So MediShare is the most trusted name in medical bill sharing.
How many
And
members, Dr. Day?
well, throughout the country, it's
Yeah.
approximately 350,000.
Wow.
Wow.
Okay. So you got a big
Wow.
base
Yeah.
to draw
So it's a
on.
It,
proven track record, and we're Christ centered. We're an accredited healthcare sharing ministry that helps Christians in this community of believers stay true to their biblical convictions. And we understand how living for God drives every life choice. So we create programs and services to help you honor Him. And MediShare supports the whole person. It's a biblical wellness. We're a community of believers committed to so-called biblical wellness to help our members live healthy and holy lives. Quite distinct from insurance.
I want to get personal in a sense, just honestly with you. So you're a medical professional. What was it that drew you to using your skills and talents
Sure.
with
So
this organization? How did that come about?
So for over 25 years, I've been in practice in Central Florida, mostly in the hospital base, but also as a family physician in the office setting, but mostly in the hospital setting. And then I took a journey into working in hospital administration. And then it was 2 Januaries ago. I was sitting on the couch with the wife, and we're thinking, I have these clinical skills and administrative skills, but wouldn't it be nice if there were some way of leveraging these skills in a God-honoring way? I
Mm.
mean, that company doesn't even exist, does it? So the next morning, I get a air quotes unsolicited ping from a recruiter. Say, hey doc, there's this company called MediShare that needs a chief medical officer, and
The
Wow.
next morning.
the next morning,
Wow.
and you know what, doc? It's right down the street from you, 20 minutes from where you live. And so it was kind of a cosmic two by four, yeah,
Sure.
a door I had to knock on. And I think a lot of Christians can have stories like that where
Oh,
where
for sure.
God intervenes and nudges us in our journeys towards positions and roles and relationships, so that He can be honored and glorified.
Yeah,
Wow.
that's awesome.
That is fantastic. Thank you.
So it was really
You,
prayer. It was a prayer for how to leverage the skills in a God honoring way, and then the next morning came the call.
that is just the
Wow.
coolest. I'd like to press in on what many people listening to this are probably thinking, which is, okay, can we talk about how this actually works?
Mm.
And is MediShare likely to save me money. And how do you know if this is right for you? Like, are there people who aren't really the right fit? So let me just set this question up by sharing something that when I was asking those questions, whatever year it was, when I was asking those questions, I talked to a friend who was a MediShare member and said, "Hey, we need to do something because all the insurance companies have pulled out, and what is MediShare like, and how does it work?" And she said, "It is going to take you a little bit of getting used to, because the model is somewhat different from the way the business model is different from the way traditional insurance works, where the concept is not so much, hey, you're going to have a copay of this and a certain amount of that." She said, "Think of it like that MediShare is sort of like a family, and like imagine that you've got a family of 10 people, and you're kind of considered responsible for your own costs. You go to work every day, you have an income, and you pay the expenses. But then something happens, and the whole family goes, okay, this is beyond what this one family member can do. So we're all going to chip in after a certain point in order to cover the costs." And so that's kind of this, my friend said, that's kind of the MediShare model. Like every family is kind of responsible. It's sort of like a deductible, kind of, but you're responsible for like everything. It's not like there's copays and this and that and the other, even though technically there are, but you're kind of responsible for everything up to your deductible. And then after that, all the members of the, now we know, 350,000 strong family all chip in. But there are differences in how it feels and how it works. And so I'm curious, especially for our listeners, Dr. Day, if you could sort of speak into that and help them understand, how can someone listening to this know if this kind of model, if MediShare is really the right fit for them? Like, are there people for whom this would not be the right fit?
Yeah, that's a common question. I might back up the bus a little bit to talk about the model of insurance, where insurance, you have a great big corporation with a great big pool of money that guarantees payment for all the bills that come in, regardless of what caused the bill. They'll pay that after of course, you pay your deductible. But with healthcare sharing, and specifically with MediShare, what happens is that bills come in, and then the staff at Christian Care Ministry, CCM, they see whether that bill, how that reconciles with the member voted guidelines. And if the membership has stated in their guidelines that that's a shareable bill, then payment is made to the provider, being a hospital system or the doctor. So the members decide what will be shared in through the guidelines, and that sharing occurs through the individual member accounts. So I mentioned we have about 350,000 members. Well, that means there's 350,000 accounts sharing in each other, and that sharing process is facilitated by CCM, the Christian Care Ministry, who administers or facilitates that sharing between individual accounts. So when, for example, if Mrs. Smith is seeing the doctor and a bill comes in, maybe it's $500 or something like that, and we determine that it is shareable according to the guidelines, well, then money is shifted between the member's accounts so that a check will go from that member's individual account, Mrs. Smith, to pay that provider. So the providers will see a check from Mrs. Smith, not from MediShare, not from Christian Care Ministry. So it's quite a different model in all that.
And that's good. Thank you for helping people understand that. I know that there are people who are wondering, who, like the Mrs. Smiths out there, but is this model right for me? Like, are there people for whom this is not the right model for them?
That's important.
We have to talk about that, because
Yeah.
that's what our listeners are asking themselves.
Mm-hmm. Yeah, that's a very important question because we want the right fit, not just numbers of enrollees. We want our members to be the right fit for their program. It is their program. So, pre-existing conditions, for example, are not shared in for 3 years into membership. So, if, for example, you have maybe you have a cancer prior to entering membership, and for that cancer, you're on very expensive chemotherapy medication. Well, MediShare would consider that a pre-existing condition, so perhaps that would not be a great fit for you. Or perhaps you're on expensive medications for weight loss. That's a common thing nowadays. Some of those medications for weight loss are super expensive. Well, that would be considered a pre-existing condition and not shared in. So that would be an example of not a great fit. If you're looking for so-called coverage, that is, we call it shareability, in something that is a non-biblical lifestyle, well, that wouldn't be a great fit for you. If you're not a Christian, this would not be the right program for you. And I say program, but actually it's a family, it's a community of believers.
Mm, right.
Well, and I would say, if I could just add in there, for people who, for whatever reason, it may not be, it may be pre-existing, it may not be, prescription coverage is not a big part of MediShare. Now, it is for something like my breast cancer, where the medicines that came along with the treatment and, whatever, those were covered. But like my daily cancer therapy drug that I take, I pay that out of pocket. That's not part, prescription drug coverage is not as big of a part of the MediShare program on a day-to-day basis, even though we're long past the pre-existing condition phase and all that kind of stuff. That would be for me to say to somebody, look, if that's a big part of your life for whatever reason, maybe that's not the right fit.
That's correct. And we don't have a formulary or a drug benefit, so to speak, other than if there's for your example, a new in membership diagnosis of a cancer, that is shareable. So you experience that. But
Yeah.
there is no formulary in MediShare. But the good news is that we offer access through an organization called Navitus that provides deep discounts on pharmaceuticals for our membership. Sometimes the insured expense of a medication can be sometimes even more expensive
That's true.
than using discount services.
Yeah.
Many of us have heard of GoodRx, so there are a lot of people who use GoodRx for a discount service. Well, we use Navitus, which provides members with at least as good as discounts as GoodRx. So although there's not a formulary, we do offer a program for our members
discounts.
Sure.
for
Absolutely.
deep discounts. So that matters. And it also reminds me of, well, say you're under the care of a psychiatrist or a psychologist. The membership doesn't share in mental health, so one has to consider whether the in-person visits with your mental health specialist is a good fit or not, or maybe you'd be able to afford those out of pocket because the monthly share amount for MediShare is so much less
Right.
than insurance. So one might say, oh, well, this might not be shared in, but you save so much up front by the cost per month for MediShare is very often a third or a quarter that of what an insurance premium monthly might be. For example, a screening mammogram. Well, that's generally recommended maybe every 1 or 2 years after age 40. The average price of a screening mammogram is $650. Well, you can exceed that with one monthly payment of insurance.
Sure.
Yeah.
Or think of maybe a screening colonoscopy. A screening colonoscopy generally recommended after age 50 every 10 years. Well, the average cost of that is about $2,700. Well, that too could be 1 or 2 months of insurance payment. So the amount you save makes it very affordable to do these out-of-pocket expenditures for screening?
Like I said, it takes a minute
It
getting
does.
used to, because you're thinking about things in
In
sort
a
of
different way.
in a different way.
Can I chip in on that one? So one of the challenges, and not challenges, one of the things that we had to adjust to, or I had to adjust to, is healthcare and insurance has always been just so opaque to me. I don't even know where to go, how to start, all of those things. And with MediShare, we had to kind of do a few things ourselves, kind of in advance of medical interventions on things. And I happen to be blessed to be married with an organizational guru who handles so much of that. But on occasion, I had to wade in and do it. And at one point, it felt a little daunting because I haven't put the time and effort into learning how to do this stuff. And so about 3 years ago, I even hesitate to say this because it's old guy surgery. I had chronic hip pain for a decade and did nothing about it, just thought that it was something to live with. And
suck it up.
yeah, so finally got an x-ray, and apparently cartilage is a good thing, but I had none of it in either hip. So I needed hip surgery. So how was I going to go about this? And the surgical center that I was going to be working with or having the surgery at weren't particularly familiar with MediShare, but with a few other sharing organizations, medical sharing, and didn't have a high regard.
For
And so,
those,
and
yeah.
they were very, very hostile wasn't the right word, but not much
Skeptical.
not much lower than that toward this. And so I contacted MediShare. Well, Shaunti contacted MediShare, and we understood that MediShare would have a third party that would deal with or talk with
Well,
the surgical center, and
a third party that would basically negotiate a rate, and hey, we're going to write you one check up front.
exactly. And the surgical center loved it, but it was an extra step, something that most people don't have to go through. And I will say that the third party that was engaged, they had to talk to me a couple of times. And this guy, I'm overstepping it by saying he became a friend, but many, many months after the engagement, my hip surgery, we were still communicating about shared hobbies, things that we loved to do, hiking. And I had a friend because of MediShare, and I got 2 new hips. So
and they were completely paid for.
And it was fantastic. But I had to do a little bit of legwork on the front end to educate.
Yeah, I appreciate you sharing that story because it also emphasizes that we care for you, Jeff, and we want to, as brothers and sisters in Christ, to have that trusted relationship, and not just as a one and done type of thing, but longitudinally as we, care for you and come alongside you in the healthcare journey.
Yeah.
And you mentioned that sometimes perhaps there was not all healthcare sharing ministries are the same. And so that's why I like to point out that MediShare works and that we've been around for over 30 years with that proven track record. And as one searches the field of healthcare sharing ministries, well, how might one decide which is the right fit for you? Well, check out that they have accreditation. So MediShare is accredited. There's a website for healthcare sharing ministry accreditation. It's publicly available. If you just put that into a Google search, you'll see that. Do they operate on a self-pay model, or do they negotiate discounts on behalf of members? So you've mentioned to that we have a team that, on behalf of the members, will go in there with the providers to negotiate better rates on behalf of members. So that's good for the individual member. But what that does is it leaves more funds available for the membership at large to help each other in sharing. So it preserves the organization's ability to do their very mission in sharing for each other. And then check out, are the guidelines publicly available? If you, again, just go to like a Google search and type in MediShare guidelines, you'll see it right there. It's publicly available, full transparency on how decisions are made as to what's shareable. And actually, Shaunti, to your earlier question, that's a good idea for someone who wants to see if it's a good fit for them. Well, just go on to check out our guidelines, and there you will
Great
see
point.
whether you can see what's shareable, what's not shareable. There is a mystery as to how insurance makes their decisions or denies something, but we aim to share based on what the guidelines say. So just check them out online. It's really quite easy, and we're accredited, and we'll negotiate on your behalf to get those discounts so that more sharing can occur. And as I mentioned, that's over $50 million a month is shared in now. So that's $500 million with a B shared in annually. So it works, and it's price centered, and it's so much more affordable per month than standard insurance, and you can have that peace of mind knowing that you're sharing in God honoring healthcare.
Amen. So we've covered a lot of ground here. I know that people, when they listen to these things, they go, "Oh my goodness, I got to remember that." But nobody can remember everything that we've shared, that you've shared. If there was one big, kind of thing that we've covered, or that you would maybe has yet to be said, that you'd want our listeners to take away, what would it be, Dr. Day?
Well, I think healthcare is getting more expensive, right? And so for Christians, know that there is an affordable option for you, MediShare. It's a leading community that supports Christians, and Christians have an option that aligns with their faith and values. In a time when healthcare feels increasingly impersonal and expensive, the MediShare community, this family, stands out as a Christ-centered solution that brings people together, not just to share medical costs, but to share in life's burdens and to engage in prayer. So every story within the MediShare community is a reminder that faith and stewardship can go hand in hand. Members save significantly compared to traditional insurance, while experiencing a level of care and connection that can't be measured in dollars alone. It's measured in the stories of hope and healing, like Shaunti had mentioned. This isn't just a healthcare choice. It's a lifestyle of generosity, shared values, and a tangible impact.
Thanks for sharing that, Dr. Day. It is such a helpful alternative right now, to for people. And if you're, we just wanted for those who are looking for a potential alternative, who are wondering, is there a way to bring some of these costs down? Because I know it's incredibly hard for us to afford, these kind of high monthly costs, and it's a blessing to have this lower cost option and work with all these other believers, and we just wanted to share it with everybody, with our listeners.
Well, I mean, we've researched and worked on how to help people thrive in their relationships, and one of the challenges that everyone knows is finances. And if there is a way that we can lower the temperature on the difficulty for people in their financial, obligations, and MediShare has been that for us. That's a gain for the relationship.
So
Amen.
I just want to encourage, I just want to encourage you, if you're listening to this and you are currently looking for something for your family, your insurance, a sharing ministry, whatever, but you need something different, and you want to consider if MediShare is right for you, go to medishare.com/serve, and that will link to our podcast. They will know that you came because you listened to this and you were interested. Or text the word serve to 70246. So just go to 70246 and text the word serve. So I would just encourage everybody, also, if you have friends who you know would be interested in this, because we're all talking about this today, send this podcast along to them, and see if this is something that would help them as well. And also tag us on all your social media channels and get this sent around. So thank you, Dr. Day, for coming on the podcast today.
And thank you for responding to that nudge as you were sitting on the couch with the wife, talking about what the future might look like for you. So thank you.
Thank you. Thanks be to God, and God bless you and your listeners.
Thanks for listening to I Wish You Could Hear This. Remember to subscribe to our podcast, and as always, forward today's audio or video link to a friend, counselor, or pastor who would be encouraged.